Self-measured blood pressure is what the words sound like, so the patient measuring their own blood pressure, typically not in the clinic, so in their home, around daily life. And this is really the most accurate blood pressure measurement that is available, right? So patients come into the clinic, they may be nervous, they may be in a hurry, they may be late for their appointment, whatever it is. There's a variety of reasons why their blood pressure at that moment is not necessarily reflective of their blood pressure, their ambulatory blood pressure walking around every day. And the recommendations that are used for blood pressure management are based upon basically what people's blood pressure is when they're walking around every day. That's the blood pressure we want to manage, not the blood pressure in the clinic. So if we can develop strategies to engage patients to measure their own blood pressure, to understand what those numbers mean, and to actually, that empowers them to understand, again, maybe how things affect that blood pressure, their diet, other activities, and then report those accurate numbers to us, we can incorporate that into our decision making rather than, again, making our decisions based on a point in time in the clinic when they may be uncomfortable and their blood pressure may be a little higher than when they're walking around during the day. I think all of us recognize in practice that, again, we want accurate blood pressure management and measurement. So one reason to adopt this strategy, again, is to get a more accurate blood pressure measurement that's reflective of patients as they move throughout their community and live their lives. Another important aspect, I think, is really that patient engagement. So rather than us doing something to the patient, they are measuring something themselves, understanding what that is, and then again, engaging with us in reporting that and us managing that together. Self-measurement can go a long ways towards that engagement of patients as well. You know, every clinician who's doing this has a patient story, a situation where patients, you know, in the clinic have a variety of reasons why their blood pressures measured are not the most accurate.
I'm Sarah Woolsey. I'm a board-certified family physician, and my practice has been in federally qualified health centers for over 20 years. And I'm the medical director at Imagine Health in Utah. I became a convert to self-monitoring blood pressure when our clinics implemented a program probably about 6 years ago. And we had this program, we were made aware of it, and had used it a little bit, but wasn't quite sure. And then I had a patient come in, a patient I adore, who has low health literacy, low actual just functional literacy for the English language. And he was a challenge. We didn't really know what was going on with his blood pressure. He would come into the clinic and sometimes his numbers were normal, sometimes they were high. And I felt like I really didn't know what was going on. And I thought, let me try self-monitoring with this patient. But I was skeptical just because of his skills. But with my health educator partner, we had him trained in the monitor. We had a simple checkbox sheet where he put his systolic and diastolic numbers twice a day, every day. And within 2 weeks, we could get a handle on what his blood pressure was doing. And he began to tell me, I noticed, Dr. Woolsey, when I smoke, my blood pressure is higher afterward. And when I take my pills this way, one in the morning, one at night, my control is better than if I take them both at the same time of day. And he had actually started to figure out some things about his own hypertension control with this information. And at that point, I was hooked. I thought, you know what, with the right partnership and training, any patient can do this. The information is invaluable. And this patient was super proud to bring me his sheets as well as his cardiologist. And his cardiologist was pretty impressed that this gentleman, who again, on the outside appears not to be very engaged in his health, was checking his blood pressure and bringing that data to him on a regular basis. So I'm a convert. Self-monitoring makes a difference with all of my patients.
If clinics start a program of self-monitoring of blood pressure, it is important to think through the steps of that program. The first thing you want to do with a program like this is to figure out who are you trying to reach. So who is your population? There's a population you have of people with high blood pressure or where you need to actively manage their blood pressure due to other chronic illnesses. That's a clear population. But then there's going to be folks that you find with previously undiagnosed hypertension that you need to be able to think about as well in a program. And then thinking about that process. So for those people with known hypertension, how are you going to ask them to engage in blood pressure management? Are you going to ask them to self-monitor? And then thinking about the monitors themselves. Are you providing those monitors? Are you using their home monitors? Do you know they're accurate? Thinking about how the patients are communicating with the clinic. And then the last step is thinking about how the action happens in the clinic, who is able to act on that information. Some clinics on that last step have developed protocols to manage numbers for folks, so a nurse can act on patients' blood pressures and make changes in their blood pressure management, or a pharmacist, folks that are integrated in the clinic. That doesn't have to be the doctor deciding all of this. They can decide those things ahead of time as a practice and develop standing orders for a program like this. I think the goal is to decide who's your population, how are you engaging them, with what equipment, with what tools and resources, how are they communicating back with the clinic, and then how are you acting on that information? So it becomes a loop of sort of continuous change if you need to, or making sure that everything's stable if that's where the situation is for patients. It can be a little daunting to think about starting a program, but there are links and resources available where you can learn from other folks who are doing this and just get over the first steps of starting something and learn how to do this from folks who are actually doing it.